The information provided in this podcast is for educational and informational purposes only and is not intended as medical advice.
Hey, it's Nikki. Thrilled to hand the mic over to our friends at Testosterone MD. You might remember David and me sharing our pretty in-depth health journey last year, from a devastating diagnosis to our taking health by the driver's seat. We chose to partner A to B first with the health professionals that have helped us most. Collectively, David and I, we lost over 60 pounds, and so many other aspects of our health have us feeling more lively and confident these days. So look, we're on a learning journey with you, and we know you agree. Health is so crucial to our ability to live our best lives. P.S. Don't wait to hit this team up at Testosterone MD for a free concierge coaching call. There's a link in the show notes, or feel free to ask us. But this action could be the start of a whole new you. It was for us. So I'm passing the mic to our partners at Testosterone MD.
Hey guys, thanks for tuning back in to Activate Your Best Health podcast with Dr. Saddoris and Leslie Snyder. We're all going to be focusing on the topic of testosterone today and everything that entails, and some of the therapies that we offer and why they can benefit you greatly in today's world. So I'm going to turn it over to Dr. Saddoris to kind of go over the role of testosterone, kind of where it's produced, and just some oversights into that hormone.
Yes, I think testosterone treatment is so misunderstood by a lot of physicians. A lot of people think, they're just using it for sexual performance or increase the libido. But they fail to really realize that low testosterone can be very harmful in a man, and that it's very important that it's actually diagnosed. Harmful in the sense that you increase diabetes from it. You can also increase cardiovascular disease from it. You can increase actually prostate cancer. There's some studies out showing that low T's actually can be associated with increased risk of prostatic cancer. We used to always think that lowering your testosterone is a treatment for it, but they're having quite a few new studies showing that that's not necessarily true. Depression severely increases with low testosterone. And I think that low energy, low motivation, extreme fatigue, basically they exhibit a lot of depressive symptoms that are just remarkably resolved with just properly treating the underlying cause, rather than giving them an antidepressant, which has its own set of side effects and is not correcting the underlying problem. So important that we correct the actual problem, and that will take care of the other aspects that low T creates. We're seeing a lot more younger people with low testosterone. I think the biggest problem with that is that we put hormones in our food. And then also there's lots of chemicals. And I think that all of these things are having a negative impact on men. When I first started medicine over 30 some years ago, most of men that had low testosterone were usually in their 70s or 80s, and I'm finding them in their 30s and sometimes late 20s. Why is that happening? And I'm sure it's all related to the food that they're intaking and the chemicals that they're consuming that's having a significant effect on their body to produce a very vital hormone that they need to sustain just making them feel good and feel happy and feel motivated and doing the things that they need to do as a person to make them feel like they're complete. And so our biggest goal is, one, do we make a proper diagnosis? If someone comes in with low energy and fatigued and a man having depression symptoms, I no longer think, that's only in the old man. I would certainly check that also in young people. A lot of opiate drugs used for chronic pain causes low testosterone and has significant impact on the well-being of the person. And so I usually check a free testosterone and a total testosterone. The total is basically what's bound in your body plus what's available to your tissue. The problem is a lot of doctors use that to diagnose. But unfortunately, it's not telling you what the tissue's getting. There are sex hormone binding proteins that will actually bind the testosterone so it's not available to the tissue. So even though your blood level of total looks totally fine, when they do a free level, they can find a significant low level. And so I always want to do a free level. I think that is basically going to tell us what is our body actually receiving. And that is going to help guide my treatment. Some doctors will assess sex hormone binding globulin, but there are other proteins out besides that can cause binding of the hormone. And so it's missing that if they do not check the free. Like if they have a low thyroid condition, sometimes that can cause binding to the globulin that's not picked up by just checking a sex hormone binding globulin. So free is the way to go. It's a little bit more expensive test, but the cost is well worth it because we'll be not missing a large number of people who are suffering from low testosterone that are not being diagnosed, nor are they being treated. So a lot of times people say, well, what is the symptoms of low testosterone? And I've kind of went over some of that. Depressive-like symptoms, low motivation, fatigue. They just don't want to do very much. Low testosterone also affects the ability to burn your carbohydrates, and so they start developing belly fat, and that causes insulin resistance, which then leads to increased cardiovascular disease such as heart attacks and strokes. They also develop diabetes, and they also develop bone loss. They can start getting osteoporosis where they start fracturing bones. So it is not simply, hey, I just want to feel better. It's affecting their quality of their life, not just now, but in the future. And so that's why here at TestRx that we are always concerned about the person, not just at the moment, but also in the future. And that's why we do a lot of protective and preventative aspects to help lower potential risks that you might get in treatment.
I love that breakdown. You did such a good job of covering that from a multitude of different angles. I'm going to now pass the mic to Leslie and give you some of his insight with his background in the gym industry on how that can affect physical performance as well.
Well, yeah, thanks, John. So, as you know, testosterone fights the muscle breakdown, acting like a shield to protect, the muscle fiber from damage, things like that. Before I forget, I wanted to ask Dr. Saddoris, and I've had this argument with many of my fitness friends, gurus, and things like that, even my own trainer. So we talked about whether or not low T is the cause or the effect of, say, the weight gain, the belly fat, things like that, all these things. So what are your thoughts? Is that what comes first, the chicken or the egg, right?
It causes that problem, okay? Because what it is testosterone is needed for insulin to function better. And so if insulin's not functioning properly, what happens is that the muscles can't take in the sugar, and then it forms the excess in the bloodstream, and then it creates abdominal fat. And the abdominal fat creates the insulin resistance, then it makes the insulin work even less, and it gets into this spiraling effect of increasing problems. And so they get less muscle, increased belly fat. And I think that's a big symptom that I find when people come in to see me is say, doc, I'm working in the gym. I'm working a lot, even more than I used to do. And I'm still getting the gut. I still have the belly fat. It's actually increasing. It's not getting better. And I don't understand it, And so, and it's just because, they have this lack of a hormone that's very necessary for glucose metabolism.
Thank you. So I was right. I'm going to send him this.
Did that answer your question?
Yeah. So yeah, for me, I was diagnosed with the low T at 38 years old. And prior to that, I've been in the fitness industry since I was probably 26, 27. And I got to a point in my life where I'd look at the gym floor. I didn't want to do anything. So it was like, I don't want to work out. I'm lethargic. Naps are, frequent, things like that. And, the recovery wasn't there. You would do, you do a workout and it would take you 4 days to recover from that. So to answer your question, John, those are some of the things that, in the fitness industry that, getting your testosterone right obviously is going to help you with the recovery side. You're it's not going to it's not a magic pill. I'm not going to take, my TRT and expect to come out like Arnold. It's one of those things where it motivates you to kind of, work out and things like that, have a little bit more energy when you go to the gym. So and that's when I started like, okay, I need to do something here. And then that at that age of 38, and I'm 50 now, so I've been on TRT for quite some time now. And it was, it's probably been a savior for me, not just in my fitness journeys and health, wellness. It's give me the motivation to eat better, do the research on diet, nutrition, but it's probably also saved my marriage, to be quite honest, because, there's that point in the marriage where your wife would be like, what, you're not attracted to me anymore? Like, it has nothing to do with that. It's just the libido is gone, right? So, not, and I know that doesn't have anything to do with the gym, but that is one of the things that you know that's helped me personally.
And I think also you failed to realize that low testosterone causes irritability, and that really affects the relationship also. So if you don't feel good, you make everybody else miserable. If you're
Feel like
miserable,
you.
you create others to be miserable as well. But it's hard to have joy in your life when you just everything's blah and you just have no desire to do anything. And it's not just having sexual, it's just anything you have low desires. And that's what's so sad is you're in the prime of your life. And you're acting like you're a 95-year-old, of like you're like nearing the end of your life instead of, you're still in your early stages of your life. So, but I think the thing is that, a lot of times people sometimes think, well, a little bit is good. A whole bunch will be a whole lot better, right? And I had a sister that way that she made apple pie for my dad, and she loved cinnamon, and it asked for like a half a teaspoon of cinnamon, and she thought, half a cup would be good, and it was like pure black, and it was like destroyed it, right? Well, that's no different when we're trying to take a medication. There is a window of benefit. And anytime you're below the window or above the window, it has side effects and problems. And so that's why it's so important that your physician monitors your levels. And you want to monitor your free testosterone because that's what your body is receiving. And if you get too high, you have increased risk of cardiovascular disease because it affects your lipid profile and your good cholesterol drops, and it also causes problems. And then if you're too low, you have insulin resistance, and that causes inflammation, and that triggers you to develop strokes and heart attacks. But if you're right in your normal range, it's whatever your genetics are. And so our goal is to put people about mid-range, could be a little higher than mid-range if you're younger, and maybe if you're in your 60s or 70s, that may be more towards the still normal, but maybe a little bit below slightly normal levels. You have a wide range between 300 and 1,000. So you have that ability to be flexible based on the patient and their age and their needs that they have in their life. And so, again, at TestRx, we do monitor that, but we also monitor potential side effects. A lot of physicians will just give the medication, and they don't tell the patient. How can you make an informed decision if you're not informed about what potential problems you have? And then also, what are ways that we can avoid it? One of the potential problems is that when you take testosterone, it is a sex hormone. It is produced from cortisol. Pretty much all sex hormones are produced from cortisol. So if you have a low cortisol level, then not only is your testosterone low, but so is your estrogen levels are low, your aldosterone levels are low. And so you have a lot of other medical problems besides just low T. But the testosterone is produced in the testes, and there's a hormone that's released from the testicles called LH, and it stimulates the brain to produce more. But it produces more when that's stimulated to stimulate your body to make more sperm and also testosterone. So if your sperm levels are now being suppressed with treatment, your side effect is that you're going to have a reduction in your fertility unless you take a medication to preserve that. Now, a lot of men that I see, they say, I have 5 kids. I really don't want any more. Okay, fine. Some men say, hey, I've already had a vasectomy. Definitely, I don't want to take something to preserve my fertility because I did something to prevent it. But for a young man who's not told this side effect, who's just put on testosterone, or he gets testosterone off the street because, he's wanting a certain image that he wants to create, and doesn't realize that he may be affecting permanently his ability to have children. And so those are things that we always go over with people, that when we start treatment, and have them be aware of potential side effects that you do when you increase your testosterone. You also increase your estrogen levels. And, every man needs to have a little bit of estrogen. It's very important because it helps preserve their bones. But the problem is if excessive estrogen increases the risk for blood clots. And that is a definite problem, that a person can develop. And so, a lot of people don't even monitor a person's estrogen levels to see if it's too high and whether they need to take a medication to help lower it, but not excessively lower it. And so, we need to have comprehensive evaluation. We just can't have, here's something, here's a treatment, and just see me back in 6 months and I'll write you another prescription without any kind of monitoring, realizing that it can increase their blood count and they can get too thick blood. And thick blood likes to clot, so that has its own problems when especially if have too much estrogen in your system. So, so you need to know someone that knows what they're doing and are willing to spend the time to explain it to you so that you know what to do. Because a lot of times people don't want to hear these things. They just want a certain thing. But yet when they get the problem or the side effect, they'll say, well, why didn't anybody tell me about it? And I think people are more likely to follow up with their blood work and monitoring if they knew the significance of why it's important to have those things done.
So when you put someone on a treatment of testosterone, do you manage the estrogen, I guess, or do you prescribe something for, the estrogen levels, or do you wait to for, maybe let them run a course of testosterone and then see what those estrogen levels are, or is that something you do right away?
Yeah, typically in TestRx treatment, we do a panel of blood work before we even start. We do test for their prostate, a PSA, because testosterone does cause the prostate to enlarge. And if they do have an elevation, we usually want to evaluate the cause of that before we consider treatment. The other thing is we do estrogen levels. A lot of times, when I talked about that cortisol level, if you're low cortisol, you're not going to produce any sex hormones. So if your estrogen level is extremely low and your testosterone is extremely low, then that may make me want to think, is there something more than just low T going on? Maybe I need to also maybe check a cortisol level, because sometimes correcting that problem may correct the others, okay? It may not, but I think you have to have enough suspicion that if something just is kind of a little outlier, that maybe you need to dig a little further than just say, just take this treatment and you should be fine. But yes, we do monitor those before we even start treatment. We do check total testosterone and free testosterone. We do check people's blood count just to see where they're at to begin with. And we want to see what their hemoglobin is. And then I always like to do thyroid because low thyroid can kind of mimic low testosterone symptoms. And so that's important. And we also get baseline lipid values just to see where they're kind of at that moment. And then down the line, whether we need to reconsider reevaluating that or not.
I definitely wanted to touch on the hematocrit values and the reason why. I know that we may have some listeners who maybe already are on TRT and are getting more insight, or potentially people who are curious about TRT. But a big factor is going to be uh, through the use of your labs, if you come back and get an elevated hematocrit value, and that's the thickening of the blood, as you mentioned earlier, I think that we need to make it explicitly clear, like what you can avoid if you're donating. So why you don't want that blood to thicken. What would be the side effects there of if your blood thickened too much, what would happen?
Yeah. So, when you take testosterone, it increases red blood cells. Okay. That's why a lot of athletes that are in the past, they couldn't take testosterone because they found it doping to increase their red cells, to increase oxygen capacity, which is fine to a certain level. But once you start getting elevated, then what happens is the blood starts to clump, and your circulation gets thicker, and it's harder to carry the oxygen because it's kind of like pushing glue through a tube type thing. And so a lot of people who, after we removed a unit of blood, they say, oh, they'll come back and say, I felt so much better. I felt less fatigued, less tired, not realizing that having too much of something is not good for you, whether it's too much testosterone or too much red blood cells or too much sugar. They in normal ranges, they're wonderful and they're needed. But like anything, our body always has something called homeostasis, where we need to maintain within a normal range for your body to function best. And so you can get fatigue, you can get tiredness, you can start getting a swelling in a muscle in your legs and not realizing, and it can be tender and not realizing you have a blood clot. That blood clot can travel into your lungs and you get something called a pulmonary embolism, and that sometimes can be fatal. So it's important that, these things are monitored to help prevent problems. And that's what, nothing's worse than making someone feel better, but then we put them at risk for other problems if we're not doing proper monitoring. And so in treatment, that regardless of what treatment I give, I always have to monitor that person to see if I give them a blood pressure medicine, is it working? And then two, are they having side effects to it that may be something that could be very undesirable for them? And so it is always a balancing act because every person is different. I have some people that have been on testosterone a long time, check their levels, and their hemoglobin level seems to maintain and doesn't seem to need to have a blood transfusion. I've had other people that we have to do a blood transfusion on them like every 2 months or 3 months to remove a unit of blood because their blood count's getting too high. And so everybody is variable, and because of that variability, and we don't know who you are, we just need to check and monitor so that we make it as effective and as safe as it can be for you.
Awesome. Thank you for laying that out for everybody. Now, Leslie, you mentioned earlier that you've been on TRT for quite some time. How many transfusions, or I guess maintenance in general, have you experienced? Is there a lot of stuff that you have to do outside of just, injecting yourself once or twice a week and call it a day? Or I guess what insights can you bring to the table there?
I do a baby aspirin every day in the mornings, and then I do. I usually max out my donations 3 times a year, just to you know um, to keep those right. And then I do the my weekly uh, estrogen blocker. Now, the estrogen blocker that I use is a little bit different than the normal anastrozole, because anastrozole didn't work for me. So at one point I was prescribed like 3 anastrozoles a week, and it just wasn't working. My estrogen levels were in the 60s, and it was a little too high. So he put me on letrozole, which is I guess it's for women that have breast cancer, and I do a half of one of those a week or just one every 2 weeks, and it works like a charm. So those are the things that, and it's weird, like you say, everybody's so different, but just by you know through the years of just getting it right is what you got to do, and you have to stay on your appointments. You have to stay on what the doctor tells you to do, because I'm a man and I'm American and more is better, like you said. So it's one of those things where it's like early on, I was like, oh, I feel amazing. I need more. Like, that's the natural like hawk in you, especially from the
Exactly
fitness
right.
industry. It's like, give me more, give me more. And you're right. Some of those symptoms, and at one point I was taking more, you know, but then I found out like, hey, I'm starting to feel like I did when I had low T. Like the depression's there. I don't feel like doing nothing. So it was like too much testosterone equaled too less of testosterone. So it's perfect how you said that. I was just thinking back to those days. Like I was such an idiot. Like more is not better. So, and especially at my age now, like my goal is to, play with my kids, to be able to function normally, to be able to get on stage and do a show and look well proportioned, and you know not have a head the size of a cannon. So those are just some of the things that that are important to me. But one of my questions for Dr. Saddoris is w- women in testosterone. So how does that, and what does that look like?
Yes, I mean, women that have low testosterone, we typically encounter that mainly when they're getting in the perimenopausal stages. Um, just like men have testosterone and a little bit of estrogen, women have a lot of estrogen and a little bit of testosterone. And it's just that, and that's what makes us a man and what makes us a woman. But the little bit of testosterone in a woman also gives her increased motivation. It also has a slight increase in her sex drive. It does help reduce hot flashes if you're going through menopausal symptoms. Um, and a lot of fatigue, tiredness symptoms are much better with a low dose. I think the biggest problem that I encounter with women on testosterone is that a lot of doctors don't understand delivery systems. Some of them will actually give them an injection of testosterone, which in a man works great because being high, a little higher when they get the injection a day later, um, gives them that boost. But in a woman, that is very masculizing. And, a lot of the women don't typically care to have facial hair or hair on their chest, and having those kind of side effects that you can get. And then the yo-yoing, you get the high level, and you get the low level as the shot wears off, and then the next shot brings you up way too high. And so you spend very little time in the middle level. And so some people use these testosterone pellets in women. They are inserted, usually sub-Q, a lot of times in the buttock area, in the upper buttock area. And they usually last about 3 months, the pellets. Sometimes they can expel, but usually in women, getting 3 of them is not too bad. In men who'd go the pellets, they might need 10 or 12 of them, and those are very difficult to keep them from some of them popping out and lowering their levels. But that does cause some scarring. But I think more importantly, it's very difficult to titrate dosing with that. Yes, you can go 1 pellet or 2 or 3, but what about the in between that? And if you're on too much, I had one patient that was on it, and she said, I was way too much. I just felt so irritable, and it was so angry a lot and just had a lot of emotional ability, and that she went off of the pellets, and that improved by us giving her the testosterone in a cream that absorbed through her skin. And that is very effective because you can change the dosing that's in the cream. You can also change how many clicks that you give of the cream to take. And so it allows a lot more individualization for the
There,
person.
where does that apply to, like on a cream basis? Like abdominal area, or is it where at on the skin, or does it really matter?
I think that, a lot of people think that, like when they have the estrogen, like the estrogen creams, they think, oh, it has to be applied vaginally or something like that. But I went to a conference at 4M, and the one lady says, oh, I tell my patients to use this cream on their face because it's great cream, and it's very moisturizing on the cream, and it absorbs wonderfully there too. And so, really, it's your skin absorbs, it absorbs, right? Some skin areas, though, are less absorption that I tend to recommend not using. So typically, if you're using it on your back or shoulder areas, your skin is thicker there. And so I don't typically recommend that area so much. But usually the abdomen, the inner arms, the face are very, blood vessels are very closer to the surface, and the skin's not as thick. And so they tend to absorb quite well there.
Oh, thank you.
Awesome. Yeah, I know that, like with testosterone creams, one thing that I was always under the impression of is wherever you chose to rub it in, you want to be cognizant of the fact that maybe kids or somebody can come in contact with that area, then from touching you can absorb that hormone, which obviously is not ideal, especially with kids. So is that still similar when it comes to the women hormone cream as well? And if so, would it not make more sense to maybe do like inner thigh or like somewhere like that where you're not going to really have the issue of like having someone come into contact?
Yeah, I think for the men, it's mainly their partner, their female partner, that they're concerned about because it's like close contact. Okay. Um, um, if you're having it a really close contact and having a little bit more prolonged contact, then yes, there can be some absorption of that. So I think on men, we typically recommend like in the axilla area under their armpit area is a good area because usually the woman's not going to be in contact to that area. But she's usually in contact with the chest or the back or the arms, inner arms, and leg areas. So I think that in men using the creams, and the problem with a lot of the creams in the men is that they sweat a lot. And so sometimes that absorption isn't as good. And that's why sometimes even the patches and for men, for testosterone, a lot of men struggle with that because the patches will fall off and they don't tend to get the full benefit of that patch as they would normally get.
Awesome. Thank you for that.
All I could picture when you said that is me getting my wife in a headlock and how well that would not go over. Get over here, give her a little noogie. But so what does the estrogen look like in women when they do testosterone? Is that something that increases, drops down? What happens to their natural estrogen or
Yes, they don't have as high level of testosterone in their system. So there may be slight conversion to estrogen, but it would be very slight. And a lot of times we're typically giving the female estrogen because they're that that perimenopausal and their levels are down, and they're having a lot of hot flashes. They're having a lot of vaginal dryness. Their skin is feeling a lot drier, more wrinkly, those kind of things. And so in a female, we typically are giving them estrogen, low dose of testosterone, and then if they haven't had a hysterectomy, we'll give them either a sub-Q progesterone, or we can add some progesterone into the cream formulation that we're giving them. So sometimes we'll add different compounds. I mean, you can add up to 4 compounds in your cream that you want a little progesterone, you want so much of, there are different formulations of estrogens. So, we always want estradiol, which is, the E2. And then, and then you can also add a little bit of testosterone into that. And so they're only just doing one application, but they're getting 3 different medications in that at the same time. I personally like using the sublingual progesterone when we're doing the estrogen, because whenever you mix a cream, is it evenly dispersed? I'm sure it's fairly good, but when you're dealing with potentially increased risk of uterine cancer, if you're just giving pure progesterone, you don't have to worry about the buildup of the uterine lining and increased risk for developing uterine cancer from that. And that's just a personal preference. That doesn't mean someone doing something else may work perfectly fine. I just that my mind always works like, how evenly is this? How is it? Are they getting significantly the same amount each dose? So that's just my mind is always thinking of what is the best for the patient.
So one more question on women and testosterone. Are the symptoms similar in women and men when it comes to, like, how would a woman know to reach out to TestRx and say, hey, I think I need some, some hormone replacement therapy?
Here, let me stop you real quick. Let's do both men and women. How would you know that it's time to reach out to us on both sides? So obviously you're going to have to differentiate.
So I think fatigue is common for both men and women. I don't think the low motivation is quite as noticeable in women than it is in men. I mean, that's really a significant thing that they find. You can have hot flashes in women and men, but far severe in women than men have hot flashes from low T. Vaginal dryness, of course, men don't have that problem, but that is a common side effect. Painful intercourse, libido is down, it's hard to become aroused, very difficult to have an orgasm. So those things are definitely affected, and a lot of times the low dose testosterone does help with that. And then also the body changes. You start losing breast tissue in women, whereas as men, sometimes they get increased breast tissue with low T because their testosterone ratio with estrogen is affected, and sometimes their estrogen levels in proportion to the testosterone is a little higher. Their breast tissue tends to diminish. They do get increased belly fat, which you see that both in men and women. And in women, low estrogen does increase osteoporosis, and you also see in low testosterone in men osteoporosis as well. Both of them do develop increased risk of Alzheimer's. Low estrogen and low testosterone is increased Alzheimer's in both populations. I think in men, though, mathematical reasoning might be affected earlier than in women, where it's in the sense of, what do I want to say? What do I want to say? And then it comes to them later. That timing, that processing speed is slowed, maybe a little bit more in men, noticeably earlier. Women might be more gradually having that occurring, because I think in women it's natural for us to go through these changes, and so they're gradually occurring. Whereas in men, I think it's a little bit more rapidly, and it's not natural for this to happen to them. And so I think that those are the big characteristics. The skin changes, the hair changes. They just say it's just getting older, and not realizing that, estrogen can have a significant effect on your appearance, so.
Awesome. Thank you for that. Well, we are probably wrapping things up unless one of you guys have anything else that you'd like to add. All good. All right. Awesome. Well, thank you guys for tuning in today. And we're looking forward to explore other topics with you guys about activating your best health and living in your best self, both physically, mentally, and spiritually. We will be recording the next episode for next month. So you guys will see that come out in October. And stay tuned for more. And as always, if you guys have any issues that you're dealing with personally that are relevant to anything that we're covering, feel free to post those. We love seeing the feedback and would love to help you in any way possible. So have a great rest of your guys' day, and looking forward to connecting with you guys in the future. Bye now.
So you just listened to this episode. Now, join us in being addicted to betterment. Please subscribe to the show, share with your friends, tag us, and please take a moment, leave a review. Yeah, we do want your stars, but we really want the feedback.